It is our sense, shared by many, that it does have a chilling effect on the political space and on people who are engaged in expressing themselves in groups in this country. And so that is what I expressed to the government, which they took on board. I could give you a specific example of a hypothetical implication for us, if I may. As I said, we spend $205 million approximately a year on HIV AIDS program, on PEPFAR, again, which benefits 1.2 million people in this country with ARVs. It also supported, by the way, the laboratories that were so vital for countering COVID, right? So the health program is focused on PEPFAR and HIV, but it supports the entire health infrastructure in the country. So a lot of our programs, and it should be done this way, are funneled through local actors, right? We provide money to local actors to provide services, to engage, to have public education programs that support it, that help in clinics, that set up clinics, things like that. So these are, let's say, currently trusts, PVOs, that are actively engaged in that. And they process a lot of this program. A lot of this money goes through them. You know, if a board member of one of those PVOs is rejected by a process, if the budget is frozen moving forward, right? And those are the implications of the PVO bill.